St. Bluffs came together. There was a group of people who were medical professionals in Sparta who had started this project called Project Watch, which stood for Working All Together for Community Health. And it was a mobile unit that went to these different towns. It went to Norwalk and Wilton and Ontario and Cashton. And Cashton was really the most popular place. The schedule was always filling. Sometimes they were encouraged to come twice a week. At the same time, there was a group of people in Cashton that was looking at what are the needs of our community and what can we do to make things better for the people that live around here. And that group decided that a health center could be possible so that people didn't have to travel to get their health care. And then the two groups came together and in 1993 wrote a grant to become a health center, and they got the grant and the health center opened in April of 1994.
When I first started at Scenic Bluffs, we didn't have all the services we have now. And to see where we started and where we are now is exciting. I have loved Scenic Bluffs from the beginning because of the mission, which is delivering accessible, patient-centered primary care, which supports healthier people and communities.
I started going to Scenic Bluffs 30 years ago because I had a young family and I was looking for something that was close by, and with farm chores and everything, I didn't have a lot of time to be running to La Crosse or other areas. I think the value of a community health center is the fact that it provides an affordable health care place for people to go that's local. They don't have to go very far. Scenic Bluffs being right in Cashton is such a huge asset. And not only the fact that it's affordable and that it's close, but the administration of the organization has always worked hard to bring in true professionals, and the providers are excellent.
When I think back to 1993, when I was first interviewing for a job at a community health center that didn't even exist, I'm so grateful there's people that came together back in 1993 and thought that a community health center might be possible in Little Cashton. And grateful that we got the grant. And even after getting the grant, so much work went into having the vision that a community health center could happen, but then actually the nuts and bolts work of making that community health center and then having the foresight to help it grow over the years. Everything from board members who have been serving on boards for 30 years and keeping us, not just keeping us alive, but making us grow and get stronger and having expanding visions of how much more we could do for our community's health, and for the community for going in with us. And when we had this little tiny clinic with just one doctor and referring their friends and family, and I can't imagine what the number is of how many employees we've had over the 30 years who have spent their time with us and helped to make us grow, and board members and community members that have supported us. So it's really fabulous to see that in 30 years what we have become, and we really couldn't have done it without our community members, our employees, and our patients. And when I look at a map, I just see there's so many areas that really could benefit from having our services, and it's very exciting to think that we might be able to help other communities in the future.